We've had inquiry after inquiry, failure after failure, a succession of secretaries of state sorrowfully making admissions that things are going wrong, and yet still today women are dying as they give birth in Britain. This is a catastrophic failure of governance, isn't it?
I think the first thing to say that the loss of any woman pregnant or after she's had her baby is an absolutely tragic moment, and I've never been in the room with hearing that news where there hasn't been a moment of anguish amongst all the people present. So we take maternity safety incredibly seriously. Everyone is working towards improving outcomes for women and families. It's the golden thread through everything we're doing, and is one of the reasons why we work very closely with experts who research and look into every single maternal death that occurs to understand the root causes. What are the reasons why we are seeing women dying in childbirth and afterwards? And that's why we put together a package of clinical measures to help our frontline staff really focus on the issues where we know we can make the most difference. So looking at how we improve care so women don't experience blood clots, so they get better psychological support, so women with epilepsy are better supported. All of these things will help drive up standards of care to make sure care is as safe as possible.
But how is it in Britain in 2026 we're even having a conversation about a brand new package of care to reduce maternal deaths?
I think it's very difficult to understand the rise of maternal deaths, and none of us think that care is in the right place. We don't think that things are good enough, but we are starting to see improvements in safety with all the packages of care that we have put in. For example, we introduced a bundle of care for the care of babies, and we've seen that the stillbirth rate has come down, so we have the lowest numbers of stillbirth ever seen. We've seen the neonatal death rate come down. We've seen brain injury rates come down. So we know that if we pull things together and help teams focus, we can see the results that we need to see.
We've received recently hundreds and hundreds of emails from women saying a very similar thing, that when it comes to their midwife, they felt ignored, chided if they ask for pain relief, chided if they ask for a caesarean section, made to feel like they've failed as a mother before they've even become one. All these women saying these things, they're not wrong, are they?
Being listened to is the most important thing to every woman having a baby. She has the absolute right to be at the centre of her own care, to have her concerns taken seriously. And it's why we're introducing new standards for our triage services, which is where women will come through the door if they raise concerns. And we're putting together a set of standards so all services will greet women where they are, listen to their concerns, and we've introduced phone lines in hospitals so that women can ring up 24 hours a day and get seen, get heard, and have their concerns taken seriously. Because for me, as a practicing clinical midwife, if I don't listen to the woman in front of me, then I'm not doing my job properly.
A lot of bereaved families and some senior clinicians as well talk about a cult of midwifery almost, that midwives just put too much emphasis on a natural, a normal birth over an intervention. Do you agree that the drive to reduce medical intervention has come at the expense of safety?
So I think it comes back to that point about listening to women, doesn't it? There isn't a right or a wrong way for an individual woman to have a baby. What the really important message is that she's given good information. She has that moment where she can have a discussion with her care providers, her midwives, her obstetricians, and say, what are the risks and benefits of doing it this way? What are the risks and benefits of doing it that way? What is the right thing for me? Because there are some women who very much feel like they want to have minimal intervention, and there are some women who would like to be in hospital with lots of intervention. Both of them are right. What they are doing is making choices for them that make their care safe and appropriate, and that is what we need to do for every single woman. And we need to make sure that we equip our workforce so that they can provide the care that those women need to make sure they get that experience that they're looking for.
It's one of the problems here as well. a simple one, that there are just professions not getting on as well as they should with each other, divisions within maternity care. And how on earth can you get doctors and midwives working together to prevent safety issues and to really guarantee the safety of mothers and newborn babies?
So that's one of the things that we feel really, really strongly as a national team. And I deliberately say national team because my closest working colleagues are women who've had experience of childbirth, obstetricians, neonatologists, neonatal nurses, and all of us are united in the belief that maternity is a team endeavour. We all come together to support and wrap care around women. And it's why we did a leadership programme for trusts which made that same point. We asked them to come as a team to help them work together so that they aren't coming at things from a different perspective. They aren't confusing women with different messages, so that they can wrap the care around the woman in front of them and make sure their teams are doing the same thing.
When you read Baroness Amos's interim report talking about racial stereotypes, Asian women being princesses, black women having tough skin, able to tolerate pain, did you feel ashamed?
It's appalling, isn't it? I mean, there is absolutely no place for racism in maternity care. There is no place for any woman being in the position of receiving anything other than excellent care, regardless of her background, her circumstances, where she lives, who she's friends with, what her religious beliefs are. It is just unacceptable. There is no place for it in modern maternity care. So I was appalled to read it, absolutely appalled that women were experiencing these things. And it's one of the hardest things to accept around maternity care, why we see these things. One of the issues that we've identified is trusts don't always understand their own information. They don't look at their data in the right way or have access to it. So we put together an inequalities dashboard that each trust can look at their population, look at the outcomes and experiences of their local population, and make sure they are then leaning into doing the right things to lift up standards of care so everyone gets the excellent care that they deserve.
We've spoken to a lot of families who've lost babies, and they tell us how they are fighting multiple organisations just to get basic answers. Why is it still so difficult for families to find out what's happened?
It's a terrible anguish to lose a child. I think it is one of the worst things that can happen to a human, and our responsibility as leaders in maternity is to make sure that those families do not experience that anguish. It's why we've asked services to look at their bereavement care in great detail, in huge detail, to make sure that families receive the care they need. It's why we put in standards for investigations. It's why we have a separate organisation to conduct investigations that's separate to the hospital, so that there is an objective look. People are outside the organisation, not making assumptions, but are coming in to say, what happened here? How can we understand how we make things better? Because it isn't acceptable for people to feel like they have to fight for answers about what happened to them.
Families say to us, we read these reports, we see how they say lessons will be learnt, but they don't say anything about accountability. Do you accept that families feel that no one is ever held responsible?
Being responsible and being accountable is part of being a maternity clinician. I have a deep sense of personal accountability for what happens in maternity services, whether I'm practicing clinically or whether I'm in this role. It's really important for people to understand that that is shared with all the maternity clinicians that I speak to. But we also need to help trust boards understand that accountability, and it's why we have been working to put together executive masterclasses that work with trust boards to help them see what it's like to be on the receiving end of communication from them, what it's like to experience their services, so that they can improve and make sure that they understand the trauma fully that service users go through, that families have experienced, so they don't make mistakes and don't increase the trauma that families have.
Midwifery is a difficult job right now. We hear from midwives talking about exhaustion, burnout, low morale. They told Baroness Amos they have to lie about what they do. They're embarrassed to say they're a midwife. You've got a staffing crisis on your hands, haven't you?
I feel really sad when I hear people say that they don't want to talk about being a midwife. I'm proud of being a midwife. I've been a midwife for nearly 30 years, and I've always been proud to be a midwife. It's one of the best, most incredible jobs in the world. It's why I continue to practice clinically. But I understand why people are feeling that there is a lot of discussion about the things that go wrong in midwifery and maternity care, and that they find that very distressing. We have been investing in maternity services. We have more midwives than we've ever had before, nearly 26,000 midwives in post, which is thousands more than we had before. We've been wrapping support around them, making sure that first year in practice midwives really get off to the best possible start. We've been having investment in retention midwives who help midwives have a better experience at work. But again, we don't accept that everything is where it needs to be, and we know that there's more to do.
If you've got more midwives and fewer babies being born, why is there still such an issue with burnout?
So there's often a perception that maternity is really simple. You just have a few appointments with the midwife, come in, have your baby and go home again, and that's that. But it's actually a really technical, time-critical service that involves many points of contact between women, families and the service, many interventions, lots of screening, tests, information sharing. So a huge amount of care that is unrecognisable from when I started 30 years ago, where we used to write a woman's entire history on a card that was about this big. Now we have hundreds and hundreds of data points collecting information. We go into people's history in great detail. So we're really understanding that the nature of the care that we offer is different. It's not just about a few meetings with a midwife and then come and have a baby, but actually it's a highly technical, complex service where we need lots of specialism, lots of integration with wider clinical services to make sure that women with all their complex health needs, we step up and meet them.
Midwives were more likely to talk about bullying than nursing staff, according to the Nursing and Midwifery Council survey. Have you got a problem with bullying?
Well, I think the data suggests that for some midwives, they come to work and they find it difficult to behave in the ways that we would expect. And it's one of the reasons we've put in specialist midwifery support around our services to make sure that people have the chance to debrief, to understand the emotional labour, if you like, of being a midwife. It is a very profound moment in families' lives when they have a child. And for midwives, they need an opportunity to work that through, to talk about it, to work through the stress that they feel, because otherwise we can see that there is a risk that they then don't behave well with their colleagues and that stress comes out in the wrong way.
What would you say to a pregnant woman right now who might have been watching the news, reading the headlines, and might feel very frightened about giving birth in an NHS hospital at the moment? Can that person trust the NHS right now?
So I spend a lot of time visiting services all around the country, and the thing that unifies them is a sense of restlessness about what is happening in maternity. They are not complacent, they're not thinking everything's fine, there's nothing for them to do. They're working really hard, doing lots of local initiatives, responding to their local population, and they're very keen to show me that, but then they're also equally keen to say, and this is what we need to do now, and this is what we need to do more of. Every midwife, every obstetrician comes to work because they want a good outcome for the women in front of them. And there are probably 1,500 babies born every day, and most families will have a good experience. They will have good outcomes. We are putting in the support structures, things like this package of maternity care, to make sure that we are taking action to continuously improve care. So yes, the NHS is a safe place to have a baby, and I would always urge women, talk to your midwife, talk to your doctor, raise any concerns you have, make sure they understand what it is that you're worried about, because they want to see you and they want to care for you.
Kate Brintworth, thank you so much for your time. Thank you.
Thank you.